Welcome to a Shot in the Arm podcast. I'm your host, Ben Plumley, and this is a podcast about global health and human rights. It's part of a special season brought to you in partnership with the Bay Area Global Health Alliance, which is a group of companies in the tech, biotech, and other industrial sectors, academic institutions, and non-profit organizations, all committed to improving the lives and health of people around the world. A warm welcome to all of our subscribers, listeners, and viewers. Thank you so much for your support. And welcome too to the delegates of AIDS 2020 who are watching this as a satellite symposium as part of the conference. In this episode, we are going to meet Dr. Huma Abbasi, who is the Chief Medical Officer and General Manager of Enterprise Health at Chevron. Now, Chevron has a long heritage of engagement in the global fight against AIDS, TB, and malaria, and we're going to learn more about that, as well as more about what the company's been doing in COVID-19. Dr. Abbasi, welcome to a Shot in the Arm podcast.
Thank you, Ben. Thanks for having me here. One thing I can tell you as an audience, I am one of your regulars, so I do enjoy watching and listening to your show.
Oh, thank you so much. And thank you for doing this in the middle of what must be an incredibly busy time for you, both with COVID-19 and with the AIDS 2020. So I also want to welcome our viewers who are joining us through the virtual conference, AIDS 2020, as well as those like you who are our regular viewers and listeners. But Huma, for many people who may not know much about the energy industry, you're the Chief Medical Officer and the General Manager of Global Health and Medical. What does your role entail?
So, yes, my title is the General Manager, Enterprise Health. And recently, we actually, within Chevron, transformed our health portfolio and brought it under the OEHES umbrella, which is the OE management system for our company. In Chevron, my role is responsible for 40,000 employees and double the size of contractors. We develop programs. We have clinics and hospitals around the world, and we make sure that we have health and safety programs, services, policies brought for all these employees and the total workforce. The way we are organized in Chevron, I have a department, and my leadership team comprises of 3 medical directors who are responsible for their regions. So the way we look at the world, we divide it into 3 regions. One is the Americas, which is North, Central, and South America. And the other one is what we call the EMEA region, which is Europe, Middle East, UK, and parts of Africa, which is a big region for us. And then the third one is Asia, which includes our larger Australia operations. And the way we work in Chevron, we have an integrated model of primary and secondary care. So in locations where you think, for instance, in the Western countries where we have health infrastructure and we can rely on the health infrastructure, we have smaller clinics, smaller hospitals that provide occupational health services, wellness and well-being services. But when we go to remote places and remote operations where the health infrastructure is not as what we would want for our workforce, then we put in big hospitals, clinics, and bring in staff and labs and diagnostics and clinical services so we can deploy and implement our program. And then we have a big portfolio of public and community outreach, community health, and as well as the well-being and psychological and emotional well-being services.
So it is a fantastic infrastructure that is sort of embedded in the company. I suppose, is this common for the energy industry to provide this kind of care to employees around the world? I suppose many of them are working in remote regions, so there needs to be something. But maybe many of our viewers and listeners might be a bit surprised to know that there is such an infrastructure there. How common is that?
It's not very common. We see different styles, different models in the energy industry. One of the things that Chevron takes pride in and puts a priority is on health and safety of the workforce. And we believe, and this is why we have internal programs that support our employees, the dependents, the contractors, but also we believe that when we are in these communities where we operate and have our operations, as a corporate citizen, we have a role to provide those services to our communities. So when we go into these remote locations, not only we bring these hospitals, clinics, and programs, and folks that are experts in the field of health, physicians, clinicians, lab technicians, and other specialties, but also we provide some of those services and extend them outside the fence to our communities.
Yeah, and I'd love to come on to that in a second. But maybe a bit more about you. You are a medical doctor, a physician by training, yes? How did you get into that?
Yeah. So I grew up in a third world country, and I was one of the fortunate people over there to get higher level education and become a doctor. And you see a lot of, I'm sure you talk to a lot of physicians, and there is a reason we come to this profession. And the most foremost reason is to help save lives and enhance the lives of others. And I think that has been my reason to come to this profession and stay in this profession. So I did start as a doctor in a small hospital, and just providing that patient care and helping individuals was very gratifying for me. But I always felt like I wanted to do more. And when we look at what Chevron does as a corporation in the field of health, in public health, in different countries, this is something that attracted me, just working from that patient individual care to a larger scale where you are helping and putting programs forward for hundreds of thousands of individuals. That's what attracted me. So I did make a decision at that time that I'm going to move from this individual care, which we also practice in my role here, but move to a place where I can deploy and implement programs and help with moving the global health agenda and work on those priorities by becoming part of a company that believes in health as a priority and health and safety of the workforce and health and prosperity of the communities.
And I guess one of the central components of Chevron's commitment has been around HIV. And I know many people, many delegates at AIDS 2020, as in previous conferences, might be surprised to see a company like Chevron playing such a central supporting role, sponsorship role of the conference. But there's quite a legacy there. And would love to explore that with you, because it's a story that perhaps is not told as widely as it might be. But why is HIV important to Chevron?
Yeah, so we start and begin from the premise that healthy societies and healthy communities are good for business. But when you were also into this, and we want to eradicate these diseases because we believe this is the right thing to do. And I did talk a little bit about these remote operations. So our journey in HIV actually started in the 1980s when our home, which is San Francisco Bay Area, was hit hard by this devastating disease. And then we also had internationally in our global operations in West Africa, the disease disproportionately affected the population and especially women. And we wanted to do something about it. As I mentioned earlier, some of these countries don't have the health infrastructure. And as a corporate citizen, we wanted to play a role, and we felt like we wanted to help build those health systems, health capacity, and help with the HIV journey. So in the 80s, we started by putting together these local training programs and training physicians and clinicians on HIV training. But then we moved this program a little bit on a larger scale, bigger, and we were the first energy company here in the Bay Area to have a corporate-wide HIV policy. And in fact, this year, we will be celebrating the 15th anniversary of that policy. What that policy brought us was a comprehensive program, a groundbreaking workplace program that talked about and focused on HIV training, education, awareness for everyone, anonymized testing services, and then increasing access to healthcare and capacity and providing those medical services to the employees, their dependents, and then extending that to the communities. And it would be remiss if I didn't mention the role of public-private partnerships, because we believe that all of this goes hand in hand when we work with the governments, when we work with private organizations that are in the communities. So we formed these alliances and partnerships early on, whether it was Bay Area, which is our local home, or it was far in Africa, in African countries or Asian countries. And these partnerships helped us progress our journey. We believed in Chevron, with our hundreds of years of experience in running operations, we could bring capital, we could bring resources. But then when we formed these alliances with the local governments and worked on their strategies, or through the NGOs, we brought in expertise from people who knew about the local culture, who knew what works and what doesn't work. And we were able to customize our programs and then develop those programs for our workforce. So I think one of the things I will mention in our journey has been these great partnerships. Actually, if I expand on that, partnership is woven into the fabric of Chevron's culture. And we believe that forming these alliances has helped us in many things, in operations, in running operations in these fields. But we wanted to leverage from those existing partnerships and bring those to health and set priority on health through those partnerships.
Do you know, one of those partnerships, Huma, that has always moved me is the partnership with the National AIDS Memorial. And I remember seeing, particularly with the Names Project, particularly now that the quilts are coming back to the Bay Area and have their home there now, will have their permanent home there. But it was so interesting to see Chevron embrace the quilts and to see, you know, the names of employees and dependents whose lives had been lost to HIV and who were being celebrated in these quilts. That was very moving, and it sort of really emphasized that this was a disease that affected everybody, no matter where they were. One of the things that also struck me about the Chevron workplace program was the non-discrimination policy. And non-discrimination obviously is something that is so central in the current environment. But how straightforward was it, or how difficult was it to implement a worldwide non-discrimination policy around people living with HIV?
Yeah, so that's a very good question. In fact, unfortunately, even today, when we have progressed so far in our HIV journey, we see that the governments and in some of the countries, we still struggle with stigma associated with the disease. But one thing I will mention for Chevron is that the HIV policy and the non-discrimination ties in very well with our diversity and inclusion policies. And we believe that we want to bring these programs that talk to health equity, social justice. And it has been a long journey. In late 2018, we started our PrEP journey, and we provided resources and access to PrEP for our global workforce. And
I do want to ask you about PrEP, and I think you're probably one of the first companies to implement a corporate-wide PrEP program. And right at the very start of the 2000s, Chevron was one of the first companies to implement comprehensive treatment. But in rolling out PrEP to employees and dependents, how is that going? What are the lessons that you've learned from that?
So we did deploy PrEP in late 2018 and provided those resources and access to our global workforce. And since then, we have understood that it's not an easy journey, because we are learning so much about country regulations and restrictions. When we started deploying these programs, we thought that we could use our existing program and services and provide PrEP to those services, but it wasn't that easy. And now, having experienced that for the last 2 years, I think a couple of things we've learned is, one, you have to work with local legislation and privacy requirements in those countries. The other thing is that we have been scaling up and down and trying to work and right size our programs according to the benefit designs, the health insurance models that we have in those companies, and work within those parameters and work with the premise that not one size fits all. One of the things we've also done is that we've developed an internal website for our employees that provides access to resources, education, training, and access to healthcare for our employees. And now, even though our programs have slowed down a little bit, as you can understand, with COVID-19 pandemic, but we are still continuing our journey. We continue to learn, and we have developed packages and deployment schedules for different countries, and we take one country at a time and we deploy those resources to our employees. We also keep engaged and communicating with our employees. One of the things that's very important for health programs, as you can imagine, is the communication and two-way feedback. So whenever we bring these programs, we try to make sure that we are learning about the cultural sensitivities, we are learning about the countries, but we are also learning about the health issues and priorities in the local countries and understanding those from the local employees, and then bringing them and customizing those into our programs.
So Huma, one of the other things about Chevron's approach, you mentioned it at the start, was sort of being in the fabric of partnerships. And Chevron has played a key role in supporting local Bay Area community organizations, global organizations. Which are the ones that stand out to you and the ones that you're sort of quite proud of?
Yeah, so Ben, the concept of partnerships is actually very important for us and informs our collaborative approach towards public health. And this is why we have put partnerships, especially the public-private partnerships, to the forefront of our programs. And I will start with some of our key partners here in the Bay Area, because this is our home. And one of the partners is San Francisco AIDS Foundation. We have been partners with them for now decades. And every year we get together with them and look at our priorities and develop those programs together. We are one of the two sponsors of Getting to Zero program here in the Bay Area, which means 0 new cases, 0 stigma, and 0 deaths from HIV/AIDS. The other partnership is CalPEP, an organization that helps the homeless, the people who are seriously impacted with HIV/AIDS. And we have worked with them together to provide mobile testing services, which carry out this non-discriminatory anonymized testing and provides those testing services, but recently was modified to provide hygiene services. Every day around the World AIDS Day, we get together and we have some group of employees who are volunteers within Chevron. We get together and develop these hygiene kits, which have been helping some of the hopeless and needy here. But I do want to move forward and talk about some of our global partners and our larger partnerships. And one of those which stands out is the partnership with Global Fund. So in 2008, we announced our 3-year partnership with Global Fund amounting to $30 million. And then again, we had additional 2013, another $5 million designated to that partnership, amounting to a total of $60 million towards Global Fund health agenda and health activities. The other thing I want to mention is our partners with PACT. These are partners who have helped us with programs in Nigeria, and especially in the Bayelsa state of Nigeria, which was really hard hit with HIV/AIDS. And then we extended those partnerships in Asia. As we mentioned earlier, one of the moving partnership for me has been the National AIDS Memorial, and I am so glad and pleased to see that we will be seeing the memorial will come back to San Francisco, and I want to congratulate the National Memora Quill for that, because this is one of the partnerships and tools that we've used even within Chevron to share our stories and talk about the colleagues and families and people who have lost their lives to this pandemic. And also, we have volunteerism in Chevron, and there are a group of Chevron retirees and employees who get together every year to develop these quilts. And we have developed quilts on different themes like AIDS is going to lose, like hope, and depicting our mother to child prevention of transmission programs with showing the faces of babies who were born to HIV positive mothers and were non-HIV positive. So it's been a journey, and I would say that the role of this partnership has been central and key to the success of not only our HIV journey, but even if I expand to other non-communicable diseases and programs like cardiovascular disease and others, where we formed partnerships with American Heart Association or chronic disease and join hands with American Cancer Society to bring those programs to our workforce and the communities.
I should sort of declare an interest in that. I'm a board member of CalPEP, the California Prostitutes Education Project, and it's so fascinating to see, Huma, that those hygiene kits that Chevron employees have made for CalPEP are being used extensively right now as the community in encampments and with insecure housing are sort of getting access to sort of basic hygiene during the era of COVID. That has been absolutely invaluable. As we look at some of the other partnerships that Chevron has been involved in, this podcast is a partnership with the Bay Area Global Health Alliance, and you're actually on the board of the alliance. Could you tell us a bit about what you are looking for a Bay Area Global Health Alliance, and what kind of partnerships you think would be useful coming out of that?
Yeah, Ben, I have to say that I am honored and very pleased to be in the company of global health leaders through this Bay Area Alliance. And I know that, this alliance is quite new, but one of the things that I feel that we can do as board members on this alliance is bring the global health agenda and the priorities from the Bay Area to the forefront. I know that we have some private sector organizations in this as well. And I feel and I hope that through this alliance, we can I would say, be the conscious for some of these companies and lead with our advocacy efforts and bring all these tech companies and other companies in the Bay Area to start talking about health priorities and what we need to do here to strengthen the healthcare system and also bring the focus to health.
And sort of going to the national level, Chevron is the co-chair of Friends of the Global Fight's Private Sector Advisory Council, which I guess builds on the long heritage of support for the Global Fund. It's going to be crucial in this new era to make sure that, as well as dealing with COVID-19 and other new pandemics, we don't lose sight of those three diseases: AIDS, TB, and malaria. What advice would you give to people who are wanting to make sure that we don't lose sight of these three diseases?
Yeah, I would just say continue to work and think about health equity, social justice, and continue to improve lives. And this is something that keeps us going. In Chevron, we think that health of the workforce and the communities is a priority for us. And one of the things that I like about the Friends of the Fight is that continues the support and activities from Global Fund, and through the advocacy efforts and best practice sharing and networks sharing brings those health priorities to the forefront that we have been supporting from decades through Global Fund.
So this brings us up now to these unprecedented, crazy times of COVID-19. So what has it been like for you? What have you been working on? And how are you seeing your the disruption to what you might have planned for this year?
Yeah, I mean, so we have been very busy with this pandemic. I remember from the time when we started late December with a small program through the medical teams providing response in Asia, because we have operations in Asia, and that's where it started. But then scaling that up to a corporate response through a corporate pandemic response team that actually is connected to our crisis management team and involves the executive leadership. And it's since then it's been endless days and nights, like any other healthcare workers. What we've done through this pandemic team is provided a central coordinated response, Ben, which I think is so important, and I think has been one of the success factors for us. So what we did through this pandemic team was brought in all the health experts to the center and thought about and did a needs assessment. What are the things that our countries need? And then had a central coordinated approach, whether it was developing guidance documents on the protective measures or physical distancing measures or personal protective equipment that was needed in those countries. And even in the US, the local response has been to educate people, to create awareness. My boss and I are on every other week, we go on these town calls and engage with our employees to hear from them about the stress they are feeling. The other thing we did early on, realizing and from our experience from the prior outbreaks, was put up these EAP resources for the employees and bring emotional and psychological well-being programs, because as you mentioned, these are unprecedented times where we are dealing with a pandemic, with economic crisis, and on top of this, you see locally in the Bay Area, in the US now, we have protests and other activity, and it can't be easy, and people carry that burden, whether they are dealing with a positive, COVID positive individual or a family member, or they are looking at the situation where we have hundreds and thousands of people dying globally. So what we've done is we've brought, to make our workforce resilience, we've brought a resilience app that provides resources to the employees, but also our employee assistance programs and wellness programs and other health programs to the employees so they can stay fit, they can practice being healthy, but also learn from these educational activities. The other thing we've also done, which is something that's central to Chevron, is also support the health care workers and our communities in providing these personal protective equipment. And I do want to share a little bit, Ben, from what we've done in the communities, because it's fascinating to me. Early on, we provided 100,000 surgical masks to 4 Bay Area hospitals here. In Kazakhstan, we had a team of people who worked with the local restaurants and provided meals to the frontline workers. And this is very great. In France, actually, there was a shortage of the hand sanitizers. So one of our plants repurposed their manufacturing plants and started producing hand sanitizer for the French authorities. And then through our collaborative efforts nationally, working with managing donations, we have supported organizations, especially those Bay Area and other national organizations who serve the underserved population and marginalized and vulnerable communities, to help them with donations and help with the COVID-19 efforts.
And again, a declaration of another interest. I'm closely involved with the San Francisco Community Health Center, and Chevron provided a very significant contribution to purchase surgical masks that the outreach workers were able to use in San Francisco's Tenderloin to provide health services to the homeless. So I know we were all deeply, deeply grateful to that. You mentioned the protests, Huma, that had been another feature of the last couple of months. And, really this sort of gets us to the challenge that Black Lives Matter has really put to all of us around the world, but particularly here in the United States. How has Chevron responded to that? I know the company has made some very strong statements, but how, to your mind, has this sort of impacted the way you're thinking about doing business?
One of the things I will say, Ben, here that in Chevron we have diversity and inclusion policies that talk about equality, and we've had those policies from a long time. And I have seen, as you had mentioned, my top leadership talk about racial, first of all, inequality that exists in many countries, and how Chevron has been talking about equity, about social justice, and about improving human lives and human progress. And we also support organizations that, as I mentioned, are working together to serve these marginalized populations, whether it's through health programs or our community engagements. But we have had this for many decades, and we have now extended those programs to create awareness, with our leaders engaging with the population, trying to listen and hear what the people are saying, and also responding and reacting to this by providing services that help with psychological and emotional well-being, because this could be a lot of stress on employees.
So one of the comments that is regularly made is that COVID-19 is forcing us to behave in a way that business will never be the same again. And, and I think that's been a particular note of interest for the energy industry, given, what has been happening with climate change and, the price of oil, which just tanked. So what's your sense of what the future is going to look like for the energy industry in this sort of post-COVID era?
Mm-hmm. So Chevron safely develops and delivers reliable, affordable, and cleaner energy solutions. And with our long-standing history in Chevron, we have shown resilience and have adapted to change in marketplace and conditions. So I understand that these are unprecedented times, but we also believe that energy production, especially in the growing economies and developing and other countries, we can progress human development by providing cleaner, affordable, reliable, and sustainable energy solutions. And this energy will then create more opportunities, more jobs, provide health access and education, and improve lives. So, and it's not just Chevron. I know that some of our peer companies are also transforming and bringing in technology and digital solutions to make sure that we transform ourselves to adapt to the local conditions and manage these climate change risks, and also provide those opportunities to the countries and to populations for social and economic progress.
And I guess something that's interesting for people like you and me with a public health background is that, the COVID-19 pandemic has taught us, perhaps more than anything else, perhaps much more acutely than HIV did, that pandemics really have to be at the forefront of business planning. And, public health is perhaps more important to multinational business and, just global activity, period, than it's ever been before. How do you see the role of the kind of health leaders like you in large companies? How do you see that role evolving?
Yeah, I think as a physician personally and then professionally, leading a health role in a company and a corporation that provides health services to so many, I would say that one of the things we can do is bring health agenda to the forefront and help people understand, and the governments understand the priority they need to put on these health issues. And one of the things we've learned internally from our success in these pandemics is the preparation that we did. So when we were in December, January, starting to look at this outbreak and plan for the pandemic, we knew that we had programs in place that we have been there for many, many years. We have been preparing for pandemics and not that hoping there will be a pandemic, but you always need to prepare. We have drills, we have staffs, resources that have been put together in case in unforeseen circumstances or unfortunate when we come across these incidents and pandemics, we can deploy those resources. So I think my advice to everyone is that don't lose sight of what we need to do to bring these public health issues to the forefront. We need to maintain and sustain funding to our health programs, whether it is communicable diseases like HIV/AIDS, malaria, tuberculosis, or non-communicable diseases, and then keep our focus on these diseases. One of the things I'm also worried about now is that when we work on these pandemic, we don't want to neglect some of the other diseases and the work we've done on other health threats and other diseases. For instance, vaccination and for diseases like polio and other health threats. So we want to make sure that we maintain those resources. We keep our drills. We keep making sure that we have epidemiologists and we have health leaders who are getting trained, who are talking about emergency response, and at the same time making sure that we manage the current and as well as our planning for the future threats.
So this has been quite a wide-ranging conversation, Huma, and thank you so much. But I couldn't end this without asking, how have you and your family been staying sane over the last couple of months? And in particular, have you been binge watching anything on television?
So, with a 9-year-old in the house, I don't know there's enough of binge watching I can do. I mean, in between attending webinars and attending my meetings, it's been a very busy schedule. So one of the things I've done is that since I'm not traveling and my job takes me everywhere in the world, so I have been isolating at home. I have started and focusing on some of the things I can do with family. So I'm cooking a lot, which I enjoy, and it's one of the things that I do to relieve my stress. Not necessarily binge watching, but I am one of those people who does not like watching the news because sometimes it stresses me, but I have been glued to the television and watching news. And I will say the one program I got interested in and have been watching regularly is Fareed Zakaria GPS. I do like that program much, but mostly it has been just learning about this novel disease. This is a novel virus, and I like to learn more and more so we can be up to date on the research and bring that knowledge and expertise to our workforce. But it's been good spending time with family here at home.
So Huma, thank you so much for a really insightful and wide-ranging conversation. It's just fascinating to know both what you've done as a health leader in the energy industry, but also what Chevron is doing and the wide range of partners that it has. I don't want to take up any more of your time. I know you're extremely busy and you need to get back to responding to COVID-19, but just thank you so much for being on a Shot in the Arm podcast.
Thank you, Ben, for having me here. It's been a pleasure and honor to be here on the show.
Thanks so much. Well, that's it for this episode. Thank you to Dr. Huma Abbasi from Chevron. Thanks also to AIDS 2020, and a particular thanks to the Bay Area Global Health Alliance. Our thanks to our director, Erica Spera from NewsDoc Media, and thanks to you. As always, you can find us at Facebook, Twitter, and YouTube at Shot Arm Podcast, or wherever you download your podcasts. Have a great week and a safe week.